All right, hi everyone, welcome. We're going to go ahead and let everybody come into the room, and I'll get started in just a minute. Welcome everybody. We'll get started in just 1 minute. All right. Hi, everyone. Welcome. It's 12:01, so we'll go ahead and get started. We have 57 people on the line. We're expecting another good number of folks, so we'll just let people keep tracking in. My name is Alex Caldwell. I am one of the directors at the Colorado Health Institute. CHI is a nonpartisan health policy research institute. We believe that health policy is better when it's based in evidence and research. And we've been around 20 years partnering with organizations to make health policies better and based in evidence. And so one of those partnerships is with the Colorado Department of Public Health and Environment, CDPHE, and that partnership is around this grant program. You are attending the webinar on the COVID-19 primary care vaccination program. We specifically want to bring a focus today on getting funding to you all. So the folks on this webinar today, you all are already in the program, you're in the process, or maybe you're already enrolled as a vaccine provider with CDPHE, and now you're seeking to draw down funding from this program. We're going to get really into the weeds on that, and the goal here today is to really try to answer some of your questions. We already have anticipated some of those, and we'll share some of those with you. But the takeaway for you today is let's be in touch. And so I'm going to invite my colleagues. I have a couple folks on the line with me to maybe Nina, if you have this handy, if you can drop in our contact information. We'd really encourage you to be in touch with us directly at CHI. So that's COVIDVax at coloradohealthinstitute.org or at CDPHE if you have questions about getting enrolled as a vaccine provider. We really want to get through a lot of your questions today, but the takeaway for you is there's going to be a lot of questions, and so we may not get through all of them. And we want to really be responsive. I want to also thank you for the work you're doing in getting vaccines to communities around the state. You all are essential to this effort, and we feel really honored to be a part of the response. But we recognize that you all are strapped for time, so we're hopeful that this is really useful to you. A couple housekeeping notes. Number one, this is being recorded. You can expect after this call, we will send out the recording, we'll send out the slides, and we'll send out some more information for you to share with others, either that couldn't be here today or with others in your clinic to make sure you get your questions answered. So for example, a sample invoice that you can use, frequently asked questions, things like that. You can expect that to come to you. Number two, a little housekeeping item. At any point throughout today's conversation, we really want to get your questions. And so we'd like you to use the Q&A function in Zoom. So it's at the bottom of your screen. Usually it's a Q&A button. We'd like you to use that to drop your questions in. We'll be answering those throughout our discussion. And we also will have some time at the end of today to get those questions answered. We'd like you to use the Q&A function just so it's easier for us to track and make sure we're getting all the questions. There's also a chat function. You're welcome to use that for any comments or additions you'd like to make that maybe isn't a question, but you're welcome to respond in both of those. Let's get started. Go ahead, Nina, to our next slide. We have a bunch of content for you today. We have a really quick overview reminding you what the program is. We'll then turn to my colleague at CDPHE when we really want to thank Nicole Ortiz for joining us today to talk a little bit about COVID-19 provider enrollment processes and questions you might have there. But mainly we're going to focus our attention on COPCPVax invoicing and reporting. So we're going to get into the weeds with you on when do you need to submit your invoice, what should it include, that sort of thing. Finally, we will have a Q&A session at the end. Next slide, please. Let's dive in. You all probably know this already, but to remind you, the COPCPVax grant program, it's a federally funded initiative run through CDPHE in partnership with the governor's office and being administered by our organization, CHI. This is a program of about $60 million, up to $60 million available for primary care providers who are administering the COVID-19 vaccine. You can draw down funds in a couple of ways. Funding is available by size of your clinic. And so if you have 9 or more primary care providers, you could earn up to $120,000 all the way down to $60,000, depending on if you're a smaller clinic. And you can draw those dollars down in a couple ways. One is through a technical assistance grant. That's in a form of an initial payment up to $25,000 or $30,000 if you weren't yet enrolled already as a COVID-19 vaccine provider with CDPHE, since it costs a little bit of money to actually get enrolled. That's what that recognizes. And after that first initial payment, the second way you can draw down money up to those caps of $60,000, $90,000, and $120,000 is by pulling down a per vaccine reimbursement of $50 per shot. And that is a flat fee that's delivered to you at the end of the program if you meet all eligibility criteria. That's kind of the high level look at the program. Let's move ahead one slide to really get into the key issue here, which is many of the attendees today, you are approved initially for the grant program, but you might not have all of your eligibility criteria met. And we really want to highlight this because this requires some action on your end to be able to draw down these dollars. You need to meet 2 criteria. One, you must complete your COVID-19 provider enrollment with CDPHE. Number 2, you need to have an order for vaccine recorded in SIS. We can answer more questions about exactly what those entail and specific questions about getting enrolled, but we really want to highlight that those 2 criteria must be met in order to draw down dollars. If you aren't sure where you are in the process, again, my takeaway for you today is let's be in touch. This is our email address, covidvax@coloradohealthinstitute.org. If you have a contact at CDPHE, would also encourage you to be in touch with them. If you have questions about getting enrolled, we can also do the connection with CDPHE. We're working in close coordination. Next slide, please. I'd like to turn to my colleague, Nicole Ortiz. We're so grateful she can be here today. She's from CDPHE, and she has a team representing the COVID enrollment process. She's been working her tail off for the last 18 months getting this group enrolled and really is eager to support this group. So I want to turn to you, Nicole, and just walk through just a couple of minutes on sort of high level what we need to know in terms of getting enrolled for a lot of folks here on the call. And then also we'll have time for some questions with this group with Nicole. Thank you so much, Nicole.
Thank you, Alex. That was a nice introduction. Hello, everyone. Just some high level, I wanted to go through the 3 phases of the COVID provider enrollment. Excuse me. Phase 1 is the application. It's an online application that we ask you to fill out. Within that application, we ask you for demographic information, shipping hours, shipping address. 2 key things I want to call out on that application that are really important is vaccine storage units, making sure that 1, you have a refrigerator that meets CDC requirements. At the minimum, we will accept a household standalone refrigerator as long as it can maintain temperatures. A standalone freezer is also acceptable. It doesn't have to be a pharmaceutical grade unit. If you do need a unit, we do have funding available that we can help you purchase a unit and reimburse those funds to you. The other thing we look for is provider medical license numbers and making sure there aren't any stipulations on that medical license number for your CMO. And then we want to make sure that you have a digital data logger thermometer that maintains temps 24/7. This is standard through our VFC program. We do offer those thermometers free of charge to COVID providers who are interested in enrolling. So once we get through that application, you get to the end, you sign it, it's signed by your CEO and the CMO, it kicks it into a pending approval status. From there, it comes to our team. We review the application to make sure it's complete. Those applications are uploaded weekly to CDC. If something's incomplete, we'll reach out to you. If not, we'll kick you into phase 2. Phase 2 is the documentation process where we assign you with an actual enrollment staff member, and that person will take you through that process of submitting data logger reports, temperature logs, submitting an emergency vaccine management plan, submitting tags on your outlets to say do not unplug, so those units stay plugged in and we don't worry about vaccine going out of range. And then we ask your primary and your secondary vaccine contact who's designated in your application to complete the storage and handling training. Once we receive that documentation, it's reviewed for completeness, then we move you into phase 3. During phase 3, we have a staff or one of our compliance inspectors who will call you and schedule a virtual enrollment visit. At that time, we go through all of the requirements in the signed agreement, and we just help you make sure that you understand those and that you can implement those within your clinic. Once that process is done, then we approve the application. Once the application is approved, you will get a auto-generated email that gives you the links to the ordering training that you'll have to take, and then the link to CIS, which some of you may be familiar with, which is our registry system where all vaccine is ordered and reconciled. And then there's also a link to our small order form. The small order form is for providers who don't have a high volume and need to order a small quantity of vaccine. So once we get there, you get that email and then you are open to start ordering COVID vaccine. I'm going to stop right there. I know we're going to do questions at the end, Alex. But that was just a quick and dirty overview of the phases 1, 2, and 3. We have staff that can help walk you through that process. If you need help step by step through the application, through the documentation, setting up data loggers, anything that you need, technical support, we have a team that can provide that for you one-on-one. And thank you.
Thank you so much, Nicole. And if you go one more slide, Nina, I want to make sure people have Nicole's team's contact info. Nicole's team is standing by to help with getting you through that process. So please do contact cdphe_COVIDVax@state.co.us. You can also visit the link there that we can drop into the chat to learn a little more about what Nicole shared. Again, we'd love for you to use that Q&A function at the bottom of the Zoom window to ask some of these questions that you might have about getting enrolled. I know a lot of folks here on the call today are not yet enrolled, and that's the one sort of last step before accessing funding. And so we'd love to get some of your questions answered today, and if we don't get them today, we'll follow up with this group afterwards. Next slide, please. I'm going to keep moving through. I'm seeing some questions coming in on the Q&A. Please go ahead and keep moving those in. We're going to move through the content and then get into some Q&A that we can walk through verbally. Here's a little bit of nitty-gritty on invoicing and drawing down these dollars from the COVIDVax program. Some key dates to know. Each approved site must submit one invoice that documents all claimed expenses to CDPHE. That invoice is due February 1st of next year. That invoice can include expenses all the way back to March 3rd of this year of 2021. So that's an important distinction to make. Your program really only goes until February of next year, but you can count expenses all the way back to this past spring, and that's because many of you have already been enrolled with the state as a vaccine provider. So if you have records of those staff time, of your purchasing your refrigerator, all of those things, we'll walk through what the invoice looks like, what are those expenses, but we want to make you aware that you can count expenses all the way back into March. Let's move ahead into what are those expenses. There's a couple of categories that are outlined in the invoice that describe what are the allowable expenses that you can count towards this grant program. These are quite broad allowable expense categories. The key is they must all come back to directly relating to patient engagement and acquiring, administering, or reporting on the COVID-19 vaccine. And so there's a lot of detail available in both the guidance document and the invoice. And I'd love if Nina or Spencer could drop in a link to the guidance document on this grant program and the invoice. We're going to walk through some more details here, and it may be useful for folks to actually pull those up and have some of that description available at hand. But these categories are quite broad and includes things like personnel costs, staff time, training and practice development, making sure you have the processes in place, infrastructure costs, technology costs, for example, with CIS, getting enrolled, supplies and equipment, of course, refrigerator storage requirements. And then there is an indirect expense category. You may claim up to 10% of your direct costs as indirect costs. And we'll give you a little more detail on what that is, but the 10% is the highest rate that you can claim on this grant. Next slide, please. A little more on allowable expenses. The last slide really gives broad guidelines on what expenses are allowable. There are a couple sort of caveats to that. And one is all of the expenses claimed must be necessary and of reasonable cost. And so if you start submitting things like 10 laptops for a two-person clinic, I mean, I don't expect that to happen, but like things like that will be denied. But generally speaking, they must sort of follow the rules of allowable and necessary costs associated with getting enrolled and delivering COVID vaccines. The expenses related to building modifications, so if you're actually taking down walls, changing your HVAC system, things like that, those need to be pre-approved. And so we'd encourage you to be in touch with COVIDVax at coloradohealthinstitute.org. We can help you answer some of those questions about building modifications, but things like staff time, things like hiring people, things like technology costs, those do not require pre-approval. So we'd encourage you to go ahead and count those as allowable expenses. Finally, food is not reimbursable through this grant. So just calling that out. But otherwise, these categories are quite broad. And we encourage you to check out, I think Spencer just dropped the guidance document on the grant program into the chat. There's a lot of detail there, as well as in the invoice itself. Next slide, please. Here's the nitty gritty. So lots of words here. I want to walk through this. I'd like folks to actually take a look at the invoice. Spencer and Nina, if you can drop that in the chat for people to take a look at while we're looking at this. The invoice is an Excel sheet. You can download it directly from Google. It is a Google sheet, but you don't need to fill it out at Google. I would download it off of the web. It's available online on the COPCPVax.com website. And you'll download that in the spring. You probably shouldn't start filling it out until then. Maybe take a look at it, but you'll want to fill it out when it's pretty complete and close to February when it's due. You want to download it and save it as your FEIN, your tax ID, _ your clinic site name. And that's just for our tracking purposes. You'll want to fill out the first tab called Enter Data Here, and that data is going to populate into the 4 submission tabs. So there's 2 different tabs. You really only need to fill out the first one. And that's where you're going to enter information about staff time and expenses that were allowable as indicated in the previous slide. We're going to give you an example to go through in a second. That second tab has a one spot where you want to just sign and say, yes, these are allowable expenses, and that's on line 36. It's the only place you need to actually do anything on the second tab. It's really that first tab where you're entering your data. And then on February 1st, 2022 or earlier, if you are able to sort of capture all of your expenses, let's say if you were already enrolled as a vaccine provider this past spring in 2021, maybe you could capture all of your expenses associated with that before February 1st. We'd encourage you to submit that invoice sooner if you can. You'll submit that directly to CDPHE. That's at this the email you see here, CDPHE_COVAX reimburse at state.co.us. We'll send all of this out. We'll also send out example invoices and like kind of FAQs for this group. We'll send out the slides as well, but we just want to walk through some of these details with you. Next slide, please. This is an example timeline. I'd like to just focus this group on the purple bar. So the gold bar is just sort of, here's the high level timeline. It opened in September of this year, and it goes all the way through the end of February of next year. What your clinic's experience might look like is illustrated on the purple bar. So many of you have already had your applications accepted, and maybe you're already going into the process of getting enrolled as a vaccine provider with the state. That can take a little bit of time. And so you may be sort of in that process right now. As soon as that is verified and it's recorded in SIS, we can start the process of submitting your clinic for payment. And so that's when that first payment is issued. The site then will submit your invoice, the one that we'll walk through an example of in a minute, detailing how that first payment was spent. And then in the spring, at the end of the program, so after February 28, 2022, CHI, in partnership with CDPHE, will review SIS data to determine how many shots, how many vaccines can be counted towards this grant program. We're going to check with you. This is how many we have recorded during the grant program. This is how much money you will be able to draw down in your final payment. So it's basically just that number of vaccines multiplied by $50, and that's that final payment. The key takeaway here for you is there are two payments you're going to get in this grant program. One is the $25,000 or $30,000 in the beginning. That's what that first payment issued is. And the second one is the final payment associated with getting those shots delivered. And that's the shots times $50 payment. You only need to submit one invoice. And the one invoice only needs to capture dollars associated with that first payment. So you don't need to report out, here's how I spent all the dollars associated with my $50 per shot. You only need to say, okay, if I earn $25,000 as, you know, let's say I was already enrolled as a vaccine provider before this grant program, I'm eligible for $25,000. I'm going to report $25,000 worth of expenses. Two payments, only one invoice. That's the key. I'd like to pause now and move to my colleague Spencer, who's going to drill even more into details. I'd encourage you to use that Q&A and drop some questions into the Q&A, and we're going to get to those at the end and through our presentation. Thank you so much.
Great, thanks, Alex, and thanks for everyone who's been putting your questions into the Q&A. I tried to get to the ones that I could, and I'll try to get through this content so that we have some dedicated time at the end for Q&A so we can answer some of those live. So yeah, please continue to put those questions in. So in the next several slides, I'm going to walk through an example of a completed invoice. So each of the next 5 slides shows a screenshot of one section of a completed invoice. We'll share these slides after the fact. You don't need to take a screenshot or take detailed notes on any of this stuff. You'll have this as a resource. And we'll also share the actual Excel file of the example invoice, so you can use that as a reference as you complete your own. So this particular slide here, this section of the invoice details some example direct personnel costs of a hypothetical clinic. Direct personnel costs are things like staff time spent on scheduling patients, administering vaccines, different activities related to that. So the first column describes the activities that were undertaken by a particular staff member. In this case, the first cell there is person A, activities related to vaccination. So in this case, half an FTE delivering vaccines between the particular dates that are listed there for about 6 months. The second column lists the number of hours that were associated with that particular activity. And the third column lists the hourly rate for person A. The fourth column multiplies the prior two columns together to get the dollar amount for that particular person at their hourly rate. Note that each line here is a different person. Different people should be on different lines so you can accurately describe the activities that are relevant to them specifically, and so that each individual's pay rate is used in the calculation in column 4, so that's reported accurately. So crucially here, and the nice thing is you don't need to do any kind of daily or weekly time log here for your staff for this program, which is nice. You do need to describe with some level of detail the activities done by each of the staff members, like what you can see here in these examples, and you need to report the hours worked by each person and accurately their hourly pay rate as well. So we'll move on to the next section, which is on personnel training and development costs. So this is for hours spent on activities related to training and development and expenses related to that. So in this example, persons D and E received training on how to report COVID-19 vaccinations, whether delivered in the regular clinic patients, or how to schedule and report vaccines administered at a mass vac site. So any training on communications would also go here. So for example, if you participate in a training on how to discuss vaccines with patients or something like that, that time would go here as well. And again, the same structure. The first column is the individual level description, then the hours worked in the second column, and the pay rate in the third column. So the next section, or the next slide, is actually 2 sections. So at the top here, costs related to infrastructure and supplies, and the next section is costs related to technology. So, and I know there was already a question in the Q&A here about this, but if your clinic needed to buy a fridge or a freezer to store a vaccine, that's reimbursable. You can see that as an example in the top section. If you need to, for example, purchase a laptop for reporting vaccinations in CIS, very important to get those logged in CIS so we have the record and it'd be able to adhere to the requirement to do so. All of those costs would go in the technology section. When you fill out this part of the invoice, it's important that you describe in detail the actual model of whatever product that you purchased. So not just a refrigerator or a laptop, but put the specific product that you purchased. So you can see here, there's a specific Lab Repco refrigerator listed here, and then a specific Latitude 5400 Chromebook Enterprise as the specific products that were purchased, so that whoever reviews the invoice, they know what you actually bought with some level of detail. And also list why that purchase was necessary, like you can see here in the description. For a refrigerator, that should be pretty straightforward. And then list the cost as well, of course. So indirect costs, for the purposes of this program, those are costs that are not directly associated with a single activity or a single expense. So not something like a refrigerator, not something like direct attributable staff time. These things are that would go in this category are difficult to document as direct costs. So an example of that is an administrative assistant who is handling scheduling for all patients coming to the clinic. Some of those patients are coming just for a vaccine. Some who are not coming for anything related to getting a vaccine, maybe they're already vaccinated, and some who are coming for both, some sort of service, an annual checkup or a different procedure, and a vaccine as well. So counting up the time that person, the administrative assistant, spent directly related to activities related to the COVID-19 vaccination is obviously pretty challenging, and that's why this category exists. So this indirect expenses amount is calculated for you, and it's simply 10% of what is reported as direct expenses. So your direct expenses amount added up, which you can see in the slide. It's actually covered up for me, but $22,500, and then multiplied by 10% to get the indirect amount, which is $2,250 as your indirect amount. So if we move to the next slide, and if there are questions on that indirect, we can I think we can definitely cover that in the Q&A. But if you move to the next slide, you can see all of the amounts from the various sections, all of that just added up. So you can see from each of the slides, personnel costs, personnel training and development, through infrastructure technology, all those added up, and then the indirect expenses calculated here as 10% of the subtotal of your direct expenses. In this example, it did not quite make it to 25,000. We encourage you to document all the way up to the 25 or 30,000 in your invoice. That's sort of a pointing that out as a lesson of what not to do. So if there are questions about that, we'll certainly handle that, but I'm going to move into the next section now on before we get to that Q&A section, we want to run through some of the biggest questions that we've gotten from you all via via email to that email address that's been dropped into the chat a couple times or listed in slides, covidvax@coloradohealthinstitute.org. So the first question here, which we've already covered, but this is important: what are the key program dates that grantees need to be aware of? The first date here, your invoice is due February of 22, so this coming February 1st. And you will include expenses on that invoice incurred between March 3rd of 2021 and when you actually submit the invoice, which is February 1st of 2022 is the date there, the deadline. For doses administered, and I know I answered one of these in the Q&A already, these dates are slightly different, so it's important to point those out. Sites are eligible to receive a $50 per vaccine payment administered between September 2nd, which is when the program started, and February 28th of 2022, which is, you'll note, actually after the invoice is due. And again, the invoice will only needs to include documentation for the initial $25,000 or $30,000 payment. That's why those dates are separate. And that all shots that you deliver between September 2nd and February 28th, those are all eligible regardless of if you sign up for the program after the September 2nd date. So the next question here, are there any other receipts or documentation PCPs need to provide other than that invoice? Short answer is no. The invoice is your documentation, with one key caveat: costs related to building modifications require prior approval. So before you spend any funds on building modifications, please reach out to us to work through that prior approval process. And in that process, we may ask you to provide some receipts or quotes related to that. That's a FEMA requirement. We need to make sure that we're compliant with all of that. So please reach out to us before you spend any funds on building modifications to get prior approval. Moving on to our next slide here. So how do we reach the maximum amount of funding? You may have gotten an initial check for $25,000 or $30,000, and you may be eligible for, say, $90,000 total. How do you get to the maximum there? Easy answer: administer COVID-19 vaccines. So first doses, second doses, and boosters are each reimbursed at $50 per vaccine. And Alex covered this. Do we need to tie the $50 per vaccine payment to allowable expenses? No, this is separate from the invoice. The $50 payment is separate from the invoice. CDPHE and CHI will confirm the number of vaccines delivered based on your record and CIS. up to the February 28th, 2022 date. So making sure those vaccines are recorded in SIS is a requirement in general, but also important to make sure you get reimbursed via this program. So moving on to the next questions here. If my practice received pandemic-related funding elsewhere, can we still receive the $50 vaccine reimbursement? For our program, you are still eligible to receive that $50 vaccine reimbursement payment, and you can bill insurance and get paid the $50 per vaccine payment, yes. That is specifically for the $50 vaccine reimbursement. If you received funding for something like a refrigerator, a storage unit from somewhere else, that would not be eligible to also be reimbursed by this program, because that would be getting paid twice for the same cost there. So the per shot reimbursement is separate from other funding sources. So you're still eligible to receive the reimbursement from this program, including if you bill insurance. So the next question, what are indirect costs? We ran through that in the invoice. You do not need to submit documentation related to indirect costs on the invoice form. You do need to put a little explanation of your indirect costs, but there's no extra documentation required there. Again, that is a calculated 10% of your total direct costs is the amount of indirect costs that can be billed. Our last couple of questions here, and then we should have about 20 minutes for Q&A. On the next slide, so you might have noticed in the invoice, staff time is calculated by hour and an hourly rate. If you have salaried employees, you'll need to convert their annual salary to an hourly rate. One easy way to do that is just divide the annual salary by 2,080, or the number of hours that salaried person works in a year. So a number that's often used is 2,080 to get the hourly rate. So if you make X amount, just divide it by 2,080 to get the hourly rate, and that's what you can use in the invoice. Finally, just to hammer this home really hard, you can contact us. Please reach out to us at covidvax@coloradohealthinstitute.org for any specific questions. We are waiting to respond to your questions there, and please reach out if you have any. If you're unsure about anything, we're happy to help. And now we are going to move into Q&A, and Alex, I think, will kick us off with that.
Kick us off. Great. Thank you so much, Spencer. We're getting lots of great questions in the Q&A, and we've answered, looks like 24, and we have 11 good questions left that we may need to kind of talk through. I want to make sure that, Nina, if you wanted to start with any particular question, I can also do that if you'd rather do that. What would you like to do, Nina?
Yeah, I thought, Alex, maybe we can just highlight a few of the questions that have already been answered, some of repeat questions that were coming up. In terms of expenses, allowable expenses, things like bonuses for staff, increasing hourly staff rates, thoughts on where those fall?
Yeah, Spencer, I want to make sure that we have a good answer for that. There's a lot of good questions about, increasing rates. I mean, in fact, workforce is a real challenge. We've heard that loud and clear. And so the question, we've gotten this question a number of times about bonuses, increasing rates, things like that. Spencer, do we have a really clear answer on that? Or is that something that we want to bring back to CDPHE and make sure we have a really good, clear information for this group?
Yeah, no, that's a great question. And I know there was some discussion around incentive payments specifically. And I think that's something we want to confirm with CDPHE.
Mm-hmm.
The hourly rate is also a good one. I think from the program perspective, that's something that we need to check with CDPHE as well. When you fill out that form, again, there are multiple acceptable ways to get to an hourly rate based on an annual salary, and your invoice is your documentation there. We're not requiring submitting payroll information.
Mm-hmm. Thanks, Spencer. Yeah, so I saw a number of questions coming in about, can we actually increase staff pay, hourly rates in order to encourage them to work on vaccine clinics, things like that. I don't know if we have a really clear answer to that today. And so I'm taking that back, I'm taking that down as a note that we really want to get clear on an answer for this group. So thanks for your patience on that. We're not totally sure the answer, and we'll be sure to follow up with this group on that. Nina, are there other kind of groups of questions we wanted to answer, or should we start down the line?
Yep. There were a couple questions around indirect rates, if folks have negotiated rates that are higher than 10%.
Yeah, that's a good question. The grant program pays up to 10% indirect only. So even if you have, let's say, a 20% indirect negotiated rate or something like that, you're only able to claim up to 10% of your direct costs. So thanks for that question.
Multiple clinic locations, in terms of, can they combine onto one invoice form? There's also a question about points of distribution at a college where we have provided all support except for shots that will be allowable if entered under our site. So kind of thinking about different points of distribution from multiple locations as well.
Yeah, I'll start with that one about multiple sites of distribution, and then Spencer, I'd love to turn to you if we have a good answer to the multiple locations and submitting under one invoice. In terms of multiple locations and making sure you're capturing all shots, we want to make sure that it's clear to this group that we can only attribute shots delivered to your clinic if they're recorded in that way in SIS. And so I saw a question, for example, that folks have been working directly with CDPHE on like mobile clinics for vaccines or some other sort of methods to get the vaccine out that may have not been recorded directly back to your clinic in SIS. We totally understand why that might be the case, and really want to make sure that you can like count those shots. And so if that's a question for you as to like how that would look and how that would work for you to be able to demonstrate that you've delivered those shots and have that show up in SIS, I'd encourage you to either work directly with your IT team if that's sort of clear to you as to how you need to arrange that and make sure the data flows into SIS, and or we can help do that with you. And so I'd encourage you to be in touch with us at COVIDVax at coloradohealthinstitute.org, and we can try to do what we can to make sure we're capturing those data directly from SIS so you can get credit for those payments. Spencer, do we have any insight into the question about multiple clinics recording their expenses on one invoice?
Yeah, so that's a great question, and I agree with everything you said about the sort of data reporting issue, Alex. So the invoices need to be submitted at a site or clinic level, and that should align with how you applied for the program. So if you applied for the program for, say, 3 separate clinics, then each of those 3 clinics will receive funding. And so I believe each of those 3 clinics you need to submit an invoice for each clinic that is participating in the program, because those payments are calculated separately. Is that right, Alex? I just want to confirm that.
Yeah, Spencer, good point. So in other words, each of the invoices can only go up to a max of either $25,000 or $30,000, depending on if you were already enrolled in the vaccine with CDPHE as a vaccine provider before or after the grant program started in September of this year. And so let's say if you have 3 different clinic sites, you can't take $75,000 worth of expenses and put them into one invoice because CDPHE won't be able to pay out one single check. They'll need to pay 3 different payments. So that's just kind of a bureaucratic challenge that we'll need to work with you on. But thanks for the question about if you have multiple clinics, you actually need to submit multiple invoices.
Next question about if the incentive money is taxable at the federal or state level.
That's a great question, and I don't know the answer to it. And so I think we'll need to come back to that question. I think that's from Michelle. So we'll capture all of these questions and we'll send out this information, but that one I don't know the answer to. Any others want to chime in?
I don't know. We're unfortunately not tax experts, so we'll have to
come back to that.
we want to make sure we get that one right, so we'll follow up on that one.
One thing I wanted to point out is some of the questions around indirect. So I think there was a question around whether insurance or office space rent could be considered an allowable expense. And Alex, I think you answered that that might be considered indirect. Tyler has been directing folks to CFR 200.68 for indirect guidance. I wonder, is that a document that we have access to that we could share with this group?
Yeah, Nina, is that a question for Tyler?
And that's general federal guidance under the federal grant. So any of the funds that are expended under this federal grant still have to abide by the federal grant regulations.
Mm-hmm. Thanks, Tyler. And
So,
Tyler's from the CDPHE team. Tyler, maybe we'll be in touch afterwards and make sure we have access to that so that we can send that out as part of the follow-up.
Great. All right. And then Alex, I think we can just go through some of the remaining open questions. Question about a battery backup for vaccine fridge that just went out. Would that count as an allowable expense?
Yeah, good question. And I think the answer to that is yes, if it's directly related to delivering the COVID-19 vaccine. And I also wonder if Nicole had any insight into just storage and battery backups and things like that. If you wanted to add anything, Nicole, I'd welcome you to chime in.
I don't have anything to add, but if you needed information about what type of battery backups, we can definitely find that information and give you some resources for that if you want to email the COVIDVax line.
Thanks, Nicole.
Yeah, I think the answer is if you need a battery to keep your storage unit in proper working order, then if that's a necessary expense, then absolutely. As far as the details, please reach out to us and we can connect you with sort of different resources about that.
Mm-hmm.
And I would just add, it may be time to get a new storage unit, and we can definitely help you with that. If you need help picking one or where you start, providing you that information as well.
I see a question here about we're getting requests from patients that are not in the recommended eligible group, I assume, to receive vaccines. Maybe they're too young or a not indicated booster or something like that. I think that's a great question. That's something that's certainly super clinically relevant and something that's obviously evolving at this point pretty quickly. That's not something that us as the grant administrators can really provide guidance on, but we can potentially connect you with the right folks at CDPHE on how to deal with that.
Nicole, did you want to add anything to that on having not yet eligible patients request boosters? I believe that may be kind of a moot point at this point, I think, based on the governor's recent actions.
Yeah, Alex, he has opened it up to everyone, it seems, publicly to get boosters. So
got it. So I think what I'm hearing is there's nobody that's not eligible, ineligible, that everyone above the age of 5 is eligible. I think that's right. But again, we're the grant administrators, so maybe we'll get that locked in and send that out. Nina, anything else coming in the chat?
Oh, we lost Nina. We can't hear you. Look like you're having a problem with your earbuds there. I do see a question on prior approval for a commercial vehicle, I think, Gwendolyn, that's a great question, and I'd encourage you to reach out to us directly to discuss more about that expense and sort of what that would be used for.
Have one participant with their hand raised. Chucks, if you have a question that you'd like to share, we're going to go ahead and unmute your line if you want to share. And while we're waiting on
No,
Chuck.
I'm okay.
Okay.
Yeah, I'm okay. I was just Nicole had responded, but between her response is that it's phase 2 is immediate, but we've been waiting for gosh, maybe about 10 days now between when we submitted our documentation.
Chuck, do you want to put your clinic name in the chat and I can follow that up for you?
Definitely.
Okay, thank you.
Thank you.
I'm seeing a question from Charlene, and I just want to make sure I'm understanding that the grant application is available online, and we can drop in that drops that line into the chat. But I believe everybody here has already applied for the grant program, but you may not have already been enrolled as a COVID vaccine provider. And so that is the status of your clinic. We'd encourage you to get in touch with CDPHE directly, and we can drop that contact information into the chat as well.
We want to address a comment from Hadith Ramirez. It says, I know that you're finding more details about the potential conflict between the $50 per shot payment and the reimbursement that HRSA provides to medical practices through their coverage assistance fund and uninsured program. I just want to make sure it is mentioned for the practices that might not have considered this potential conflict. Do you have any thoughts on that, Alex and Spencer?
Yes, and I believe Hadith has been in touch with us already about this specific question via TA, so I appreciate that acknowledgement, Hadith, that so to be clear on the sort of Q&A that we provided, the from our grant program, there's no concern with that $50 per shot payment. We are sort of working through how that might impact eligibility for other programs, but of course those other programs are sort of outside of, you know, we don't administer those HRSA programs, so that's sort of outside of our jurisdiction. So if you have concerns with some of those other programs, I'd encourage you to of course reach out to us, but also potentially clarify with those programs directly, or we can work with the state to work on that clarification.
There are a few questions coming in about booster approval.
Yeah,
I know that's out of our.
No, I misspoke. I think that was confusing for people. I believe that the governor has only allowed boosters above the age of 18, but there's also the you're allowed to get vaccinated. The 5 to 11-year-olds are allowed to get vaccinated now. So I'm sorry if that was, that's why I said I'm the grant administrator. So I'm sorry about that if that was confusing. Nicole, do you want to add more clarity to that? You're really more of the expert here on booster eligibility and vaccine eligibility.
Yeah, you clarified it. So pediatric vaccine is open for age 5 to 11, and then boosters are open for 18 and over for the presentations that allow that age range.
Thanks, Nicole.
We have an open question about indirect. Will providers need to list the costs, or is it applied automatically?
Yeah, Adam, it's a line that's on the invoice itself. And you do need to describe a little bit about what is included in your indirect, but you do not need to add a separate line item in addition to say, this is my indirect rate or something like that. We'll make sure to get you the link to the invoice so you can see how that's applied.
And I see another question in here about recent enrollment approval about a week ago. You do not need to notify us that you were approved. I assume this means enrolled as a COVID-19 vaccine provider. We will get that. Thanks, Charlene. We will get that update automatically in the data that we get from CIS. Now, sometimes there is a little bit of a lag before we receive that information. Once we receive it, you will receive a notification from us that you're approved and that you've been, if you've ordered vaccines, that you've been sent for payment. If you do not hear from us, if you don't hear from us in a few weeks, please reach out. There may be just a data lag there. But we can also check into it for you if it seems like there's a longer lag than expected.
We've got one question left in the Q&A. If will we need to return any of the advanced 25,000 if we cannot substantiate it and the number of vaccines administered don't make up the shortfall?
Yeah, I'll go ahead and take that, and Spencer, you go ahead and chime in if needed. The answer to that is yes. You would need to basically, you wouldn't. Sorry, the second payment, that's the $50 per shot payment, would be reduced according to the amount of your first payment you could not substantiate in an expense report. So let's say if you're eligible for up to $25,000. And you submitted your invoice or your expense report basically saying, I can only count $20,000 of this, $5,000 of your second payment will be withheld. So the second payment is how those dollars are clawed back. If for some reason that's not feasible, then CDPHE would need to take a different approach to actually take those dollars back. No one wants that to happen. And so we're really going to try to work with you on making sure you can pull down those dollars and avoid that kind of clawback situation. But thanks for that great question.
Yeah, that's a great question, and that's all right, Alex. I just want to give Tyler an opportunity to jump in if there's anything else that we missed there. Tyler, our representative from CDPHE, who may have a perspective on that.
Generally, and thank you for the time, I can't think of anything that we haven't touched on, but if there are any further questions, please feel free to reach out. And I guess the only thing I want to say is that submitting correct W-9s that have been signed and dated within 1 calendar year of submission are required. Any errors in W-9s will cause us to reach back out to you to collect a current W-9, which will of course cause delays in payment processing.
Great. Thank you so much, everyone, for your time. It's 12:59. We want to end right on the hour. The first payment, we just have one final question that we can try to get in here. The first payment should come to you within 45 days of completing all eligibility requirements. So that means 2 things. 1, you need to be enrolled as a vaccine provider with the state, the CDPHE. And 2, you need to have a recent order for vaccine recorded in CIS. So as soon as those things are done, start the clock. 45 days later, you should have a check from Tyler and his team. Thanks, Tyler. Want to thank everybody for your time today. You'll expect a follow-up email with the recording, the slides, additional information that we talked about today. I really am grateful for this group's time today and for the work you're doing on getting vaccines to community. We are thankful to be a part of it, and we welcome your comments and feedback and questions at COVIDVax@coloradohealthinstitute.org. Thank you so much.